So, can you please punch whether the voice is loud and clear, doctor, for everybody? Let's make the great start of the review of the next bout of questions. So you all have exercised your thought process on this set of questions and have answered, and you're quite confident about where you went wrong, where you are very sure. Let's check all the logic behind these questions. What is the most common location of the intracranial neurocysticercoses? It is the brain parenchyma. So typically you have the neuroimaging of the neurocysticercoses. It can present like a space-occupying intracranial tumor or a diffuse cerebral syndrome with numerous cysticerci leading to cerebral edema, or it can involve the meninges, ventricular cysticerci, leading to the development of the hydrocephalus is what you need to remember. Which bacteria resembles the fungus? Continue to punch your answers, doctor. Right? So, and also any good points that you remember in this context. It is the Actinomyces Israeli. Actinomyces, few points. Anaerobic filamentous gram-positive bacillus, not the fungus, though there is a word myces. And the pus with sulphur granules. This was the most recent NEET PG in MDS question, 2008 ka. Pus with sulphur granules abscess drain with multiple sinus tracts. What does it basically indicate? It indicates actinomycosis. The most common form of the actinomycosis, cervicofacial, doctor. Typically, actinomyces are in a very high concentration in the tonsillar crypts and gingivodental crevices. So any chronic tonsillitis, mastoiditis, otitis, they're all the risk factors for the development of the cervicofacial actinomycosis is what you need to remember. So the sulphur granules are very characteristic feature. They are found in the exudates. What does these sulphur granules basically contain? Long branching mycelia attached to the sulphur granules is a very important appearance, very important feature in the histology, and also sun ray appearance. You should remember in reference to the sulphur granules. So these are all the sulphurous granules with a neutrocytic reaction seen under the microscope. So in an image-based exam, image-based MCQs, this stands out to be a potential image-based MCQ. Cervicofacial actinomycosis. The discharging pus contains visible sulphur granules. The culture on the blood agar produce what is called molar tooth morphology. You should remember, molar tooth जैसे रहता है, वैसे अगर आप culture blood agar में करें तो actinomyces का appearance वैसा दिखता है. मैं दिखाता हूँ आपको. And history of trauma, like tooth extraction or a blow on the jaw, are the common predisposing factors. So doctor, this is the gram stain of the actinomyces. ये है ना doctor, इसको कहते हैं molar tooth appearance of the colonies on the agar is what you need to remember. So if you take the actinomyces, this is the molar tooth appearance when the actinomyces grows in the agar is what you should remember.